So what we're looking at tonight is everything you need to know to set up and be successful working from home remotely as an interpreter. Not so much skills or terminology, not so much about who to work for or how to connect with a staff position, but basically how to set it up at home so that it works well for you. Because the challenge working from home is that you don't have that IT or help desk to go to. So there are a lot of things that you can do beforehand to help make sure that you suffer less stress in the moment when something technical is not cooperating with what you need. First, I'm going to talk about a couple of situations where I don't recommend remote interpreting. I don't recommend doing this over the phone or via video for these specific scenarios. Remember when you were in high school or college, if a significant other wanted to break up with you, the worst way to get that news was on the phone or via text. You want, when something is really important, for that person to be willing to be present with you. So for that reason, all of these scenarios, family conferences when there's more than one person speaking with different levels of being able to understand English, that's too hard to try to manage long distance. Speech therapy and sometimes physical therapy, depending on the nature of the injury, can be very challenging to do if they walk away from being visible from the screen and you can't see what they're doing. Much easier when you're physically present in that space. Something called neuropsychological testing, which is an exam that can take 7 to 8 hours to complete. That's too long to have a sustained remote connection. Conscious sedation procedures where the patient needs to be able to interact with the surgeon, with the cardiologist, with the provider, but they've also been drugged, they've also been sedated. That can be very difficult to do over a device rather than when you're right there next to the patient. Things that require hands-on teaching, whether it's how to put on a prosthetic, how to check a glucometer, how to properly bandage a wound when a patient is released from the burn unit. These things also are hard when you're not there. Confused patients with dementia, hard of hearing patients, right? The sign language interpreter is not going to be any assistance to a patient that's hard of hearing because they've never used sign language. So they're going to be deaf, but they're not quite there yet. And they don't have that cultural knowledge, that linguistic knowledge of American Sign Language. Mental health appointments, if it's an ongoing counseling where the provider and the patient are already comfortable and know each other, it's possible to do a telehealth appointment for mental health. But for the very first time that someone is meeting with a mental health provider, particularly if it's a result of being a victim of a crime, of an assault, of a rape, of an attempted murder, that's very challenging to try to do remotely. It's again much more reassuring for the patient if you're physically present in the room with them. And like I said, bad news, telling somebody that they're going to die, that they have cancer that is going to take their life within a certain amount of time, that they have a disease that is progressive and has a timeline, that's hard to deliver long distance to someone in a way, at least for me, that feels respectful. And then there's the situations requiring delicate or complex cultural brokering, which is often the one that allied healthcare workers will check when making a request at the hospital. It's sort of the blanket that covers all the other situations, whether it's termination of a pregnancy, fetal death occurs, mom's life is at risk if that dead baby is not removed, but due to religion and other considerations, that's a very nuanced conversation that has to take place while parents are grieving. So there's a lot of load to that particular type of encounter. So you need to be aware of the ones that are going to be really hard to manage. And then everything else, including chemotherapy for cancer patients, including giving somebody bad news about their disease not progressing as well as it could, you can handle remotely. You just have to save the worst of the worst to try and advocate for that patient to have the opportunity to have a warm body interpreter in the room. And you're not going to win every battle. Not all languages are available in the local area, which is why this video connection is so great for so many people who have gone without an interpreter for a long time. So it is a balancing act. And I do want you to be aware of the red flag type of situations that you should try to avoid, because boy, there is a huge A to Z possibility of other types of encounters, all of which can be done remotely via VRI.